The tranquil landscapes of Hood River County, Oregon, were recently shaken by a string of alarming medical cases. 3 individuals were diagnosed with a rare and fatal brain disease known as Creutzfeldt-Jakob disease, or CJD. This cluster of cases, within a short span of 8 months, has raised concerns and left health officials searching for answers. One case has been confirmed, while the other 2 remain probable pending autopsy results. Tragically, 2 of the individuals have already succumbed to this devastating illness. The close proximity of these cases has understandably caused anxiety among residents. However, it is important to note that CJD is incredibly rare, affecting only about 1 or 2 people in a million worldwide. The United States sees approximately 350 cases annually. While the cause of these specific cases is still under investigation, health authorities have assured the public that there is no identifiable link between them, and the risk to the general population remains extremely low. CJD is a prion disease, a rare and fatal neurological disorder. Prions are misfolded proteins that accumulate in the brain, causing healthy proteins to misfold as well. This leads to the formation of microscopic holes, giving the brain a sponge-like appearance. This progressive damage disrupts normal brain function and ultimately leads to death. The disease progresses rapidly, and there is no known cure. The average life expectancy after diagnosis is just 1 year. Researchers are continuously working to understand the complexities of CJD and develop effective treatments. However, the rarity of the disease and the challenges in studying prions make progress slow and difficult. CJD often manifests with a constellation of debilitating symptoms. Early signs can be subtle, including memory problems, confusion, and changes in personality. As the disease progresses, these symptoms worsen, and new ones emerge. Individuals may experience difficulty with coordination and balance, muscle stiffness, and involuntary movements. Hallucinations, delusions, and impaired judgment are also common. Eventually, most patients lapse into a coma. The rapid progression of these symptoms is a hallmark of CJD, distinguishing it from other neurodegenerative diseases. Early diagnosis is crucial, although there is no effective treatment. There are 3 main types of CJD: sporadic, genetic, and acquired. Sporadic CJD is the most common, accounting for about 85% of cases. It occurs spontaneously for unknown reasons. Genetic CJD is caused by mutations in a specific gene and is inherited. Acquired CJD is the rarest form, accounting for less than 1% of cases. It occurs when an individual is exposed to infected tissue, such as during certain medical procedures or, very rarely, through consuming contaminated meat. It's important to remember that CJD is not contagious like the flu or a cold. It cannot be spread through casual contact, air, water, or food. The investigation into the Oregon cases continues, and health authorities are working diligently to determine if there are any common factors that might provide clues about the cause.